back of my coat to give me a nice broadcast line. There we
go. We're streaming live on YouTube.
We are worldwide.
Okay, Mike, go ahead.
Good morning and welcome to NACDA's webinar series. This morning's session is Optimizing Your Medical Partnerships in Collegiate Athletics. It's provided to you by AG Administrators, and we're excited to have a world-class panel joining us this morning. They include Jill Bodensteiner, who serves as the Director of Athletics at St. Joseph's University, where she oversees the Hawks' 20 NCAA Division I men's and women's varsity sports. Prior to her appointment with the Hawks, Jill enjoyed a 20-year career at her alma mater, the University of Notre Dame, where she provided strong leadership to the ACC, the NCAA, and Lead One. We have Alex Fairley. He's president of the Fairley Group, an uninhibitedly creative and nimble global risk consulting firm who advises clients in over 100 countries across the world and in several business segments, including the NFL, Major League Baseball, and the National Hockey League, the ECHL, Major League Soccer, and numerous NCAA conferences and institutions. Dixon Gillis, he's the Chief Executive Officer of AG Administrators. His firm manages the risk associated with student-athlete medical expense for over 450 colleges and universities, including more than half of the Power Five. We have Lyon, the retired VP of Medstar Sports Health, where he led the healthcare administration for sports organizations for the largest private medical provider in the Mid-Atlantic region. He had a portfolio that included the Baltimore Ravens, many of the colleges and universities in the greater Baltimore area, Northern Virginia, and the District of Columbia. Lou earned his PhD in sports psychology, which he found to be a huge benefit in contract negotiations and service promotion to schools. Lou also served as an adjunct faculty member in the healthcare administration program at Towson University. Along with the president of Union Memorial Hospital, he created several internships in the Medstar system for Towson University students. Eric Roedl is coming to us live from the Pacific time zone this morning. He's up early and it is his ninth year as the Deputy Athletics Director and Chief Operating Officer at the University of Oregon, where he oversees the day-to-day operations of the Ducks' 20-sport, $127 million athletics program, and serves as the sport administrator for Ducks football, men's basketball, baseball, men's and women's tennis, and he just does it all. Prior to joining Oregon, Eric served in various administrative roles in the athletics programs at Temple and the College of William & Mary. And I'm your host this morning, Mike Waddell, president of the Allen Americans of the ECHL, where I enjoy the expert risk consulting services of the Fairley Group. Prior to working with the Americans, I served as a senior associate AD for external relations and strategic communication at the University of Cincinnati, the University of Illinois, and the University of Arkansas. And prior to that, I served as the director of athletics at Towson University in Baltimore, where I had the pleasure of working with Lou Lyon and Medstar Health, and where I was honored to work with James Shipp as a critical member of my executive team, James, of course, with AG. So, let's get right to it this morning. Want to be very conscious of everybody's time, and really no more pertinent topic than medical partnerships in this world of COVID that we all try to navigate on a daily basis. And let's start out with Lou Lyon. Lou, will you give us some insight into what providers are looking for when they are entertaining these types of partnerships with intercollegiate athletics departments?
Sure, Mike. Medstar, and I'll use that as an example. Medstar had quite a few physicians coming into the system who had sports medicine fellowship training. All wanted to get out in the field and utilize their expertise. As Medstar Health, being 11 hospitals, started to grow, we wanted to find ways to utilize the expertise of those physicians. So we were looking at our engaging relationships with universities and professional teams and interscholastic teams as an opportunity for our docs to get out and test their skills and utilize their skills. Plus, it served as a great recruiting tool for us to bring in new docs from all over the country with various levels of expertise that we could utilize. That was one. The other is we were looking for long-term partnerships. We had a fairly strong, what we call halo effect of the professional realm with the Orioles, the Ravens, the Caps, the Wizards, but you really don't take care of those. They're altruistic. They go where their agent tells them to go. But the college ranks, the high school ranks, all insured student athletes come to you to take care of them most of the time. So we were looking to develop a long-term partnership. In addition, altruistically, this community benefit, particularly if you're a not-for-profit hospital. We were also looking for marketing opportunities to be able to get out in the community and try to expand our sports medicine portfolio as much as we possibly could, again, to enhance recruitment, both medically as well as non-medical staff who like the fact, hey, you took care of my son, I'd like to come here to work as a nurse, those kind of things. So those were our primary ones, not in ranking order, but they were helpful for us to be able to maintain our footprint in the sports medicine field.
Well, you certainly did a great job with us at Towson University when our management team came in the fall of 2010. The previous 5 years, the training situation, the sports medicine landscape had really been challenged. And competitively, we were not winning on the field and definitely not off. But with the help of Lou Lyon and Medstar, and thank you, Lou, and also James Shipp and his leadership, over a 3-year period, our sports performance was such an advantage to us in the Colonial Athletic Association in what we were able to provide for our students. Not only the athletes, but also the people working in the training program, that we won 7 CAA championships in our final year. And really, that was the catalyst, the partnership with Medstar, that really flipped the entire athletics program into a positive direction. And again, I thank you for that. I know James feels the same way. Now, let's transition over to Alex Fairley. Alex, can you give us some insight on how your company, the Fairley Group, approaches the relationship between providers and clients?
Yeah, the company that we have a family of companies, and the company that does most of that work is called Occinet. And I think I would characterize it really with two different phrases. The first one is an awareness that there's a partnership. Our job is to help our clients get a fair medical price, and we unapologetically press and push for that. But the reality is we first have to understand and respect that our clients and their medical providers are partners. And those medical providers, you just heard some from Lou, they do a great deal to help those folks do better, and they spend enormous amount of time, the times the doctors spend with these athletes and the athletic directors and the athletic training staff. I mean, it's a partnership. So you go into all of those discussions, while there may end up being a tough negotiation, you go into all those primarily knowing it's an incredibly valuable relationship between the medical team and staff and providers and that university. And if you miss that, you're liable to get yourself into trouble. So that's the very first thing. And then second of all, I'd say there just has to be some balance, because we do want our clients to pay a fair price, and sometimes that piece of it is not quite as comfortable to talk about, but primarily we walk into those things respecting that they're long, very, very valuable relationships that we want to protect and encourage, and make sure that we come out of those discussions where they're literally better and everyone is winning.
Definitely win-win is the goal. And in my current role in the ECHL, you do a great job in helping us out. And again, thank you very much. Let's talk to Jill now. 2 years ago, Jill, you transitioned into the AD chair there at St. Joseph's, and talk to us about the transition specific to your medical partnerships and the approach that you're building with a medical team for student athletes while exploring opportunities to partner in other ways.
Yeah, thanks, Mike. I mean, the first and foremost, I think take a step back and think what the goals of our department are. And it's to, as you mentioned at Towson, it's to win championships and it's to create an incredible student athlete experience. I happen to believe that there are no more important factors in the student athlete experience than their coach and the sport performance realm. And so, when I got here, I did a qualitative and quantitative assessment. So qualitatively, what do student athlete surveys say? What are the anecdotes of how they feel about their medical care and sport performance? From a quantitative, you certainly have to look at costs. You look at missed games and all those sort of things. And then, kind of laid out a matrix: team physicians, athletic trainers, strength and conditioning, mental health, nutrition, sports science, and insurance. And then you add your matrix, who are all my partners? And I think the thing that most athletic directors would say is we're just not integrated enough when you look at that matrix. And I think a key space of where there tends to be historically a lack of integration is marketing deals with the people who understand the medical care and the continuity of care. And so really, once I had that matrix sort of set up, then you go through and you say, all right, how integrated are we? What are the financial implications of each of these? Where are our gaps? We were probably particularly low, as many schools like us are or were, in nutrition and mental health. And then where are we on customer service? And then finally, most importantly, quality of care. So once you kind of make that assessment, then you can step back and say, how are we going to move the needle in the areas where we're low, whether it's financial or quality of care or integration? How are we going to move that needle? And so, I look at our partners now: Rothman Institute, Mainline Health, the Calm app, Sparta Science, and then, Dixon and AG, and you think, okay, I think now we're getting to the point where those things are becoming a little bit more integrated. We're looking not only at the full picture of how those things and those partners impact our student athlete experience, but we're also now able to take kind of an enterprise-wide view of it, and how are those things impacting, or can they impact St. Joseph's University from the bigger picture. So that's sort of, no doubt about it, I've probably spent more time in this area, hired a fantastic professional, Dr. Eric Ladano, to lead the group. And I'm really proud of what we've accomplished in just Eric's 1 year here.
I want to follow up on that in a second, because earlier you mentioned about the marketing partnerships. And in this time where resources are so very valuable, people may be tempted to go out and make a partnership on the medical side, looking at the marketing aspects first before the medical. But what has been your experience in going from a major brand like Notre Dame at the Power Five with abundant resources to a smaller school at St. Joe's? And how have you balanced the need for marketing and the dollars that come from that against what you have aptly said is the primary focus, and that's the care of your students?
Yeah, and I mean, you nailed it, Mike, in terms of Notre Dame had a more limited medical market in South Bend, Indiana. So the competition, Philadelphia is among the best of all cities in America at medical care. And so the market's really, really different here. So I think, at the end of the day, we have to allow student athlete care and quality and customer service to trump the marketing dollars. That's not always what the people who are out selling partnerships want to hear. But I think, again, when you look back at what are our two goals, we're trying to win championships and create a phenomenal world-class student athlete experience. If we lose marketing dollars, we got to make it up elsewhere. And this, I would also say, Mike, this has been, to my pleasant surprise, the area of everything we do that has been most donor friendly. People are into this. They're into Sparta Science. They're into the Calm app. We were the first Division I school to partner with Calm and provide that to all student athletes. That was an easy sell. And so, let's try and certainly bolster any marketing dollars we're getting with philanthropic help. And that's been a huge reason or huge way that we've accomplished what we've accomplished in a year. But you're right, those inherent sort of sometimes conflicts can be dicey, but you got to keep your eye on the student athlete.
Absolutely. And it becomes a major recruiting advantage too for your coaches, because when you go out and say, not only are we going to care for your young person in the future, mom and dad, grandma, grandpa, uncle, aunt, but we're already doing that now. And then your athletes and your coaches and your staff become your best recruiters. I mean, amazing work that you're doing there at St. Joe's. Now let's go out to the West Coast now and bring in Eric at the University of Oregon. Now, Eric, you guys at Ducks Athletics have a in-house head team physician. How does having this position on your staff there in Eugene impact your athletics medicine department as well as your relationships with your external providers?
Yeah, thanks, Mike. Good morning. I've served at a few different schools, as you mentioned in the intro, and depending on your location and how your university's set up and the network of providers that are available to you, I think that kind of helps determine the strategy you take here. But Oregon's been the first school that I've worked at where we hired an in-house head team physician. And, going back to what Jill said, with the student athlete experience being paramount, and within that sports medicine platform that you can provide to ensure health and safety, being the most important thing, having a head team physician has been a huge benefit to our student athletes and to our overall sports medicine program. I think it really starts with accessibility and the individuals that you surround your team physician with, both in-house with your trainers and your sports performance team, and then those relationships that you have external. You've created really concierge medicine for your student athletes by having that in-house head team physician. They're there at your practices, they're there after practices on game days. Really, they're accessible at all times, probably much to their detriment, but the level of expertise that they can bring as you evaluate your student athletes' medical issues, and then in particular as it pertains to forming your external partnerships and being a doctor and a physician and understanding how these relationships can most effectively work. They really help us with our external rights partner and then with our administration in terms of building out our sports medicine program. They also bring a level of credibility to everything we do. We've got outstanding trainers and other staff on our team, but having an in-house physician really helps in that regard as well. Through COVID, it's been invaluable. Whether it's meeting with local and state health officials, whether it's been communicating with our coaches, developing strategies with our administration, having that individual there to administer our testing program that we're running every day for our contact sports student athletes. So there's been so many different benefits to having this position in-house. Revenue generation is another piece of it. If you set yourself up the right way, your head team physician can bill out their time out to primary insurance, perhaps through the health center if you set yourself up as a clinic to your campus health center. So there's a potential number of benefits there. I know that our head team physician's probably ready for a 3-week vacation in Hawaii right now with everything we've been dealing with through COVID. But it's a model that really works for us. But I think it is situational, dependent on your campus and how you're set up.
So Eric, you're in the fast track. You're going to be an AD. You're going to be in the chair in very, very short period of time. What would 2020 Eric at Oregon go back and tell the Eric that worked at William and Mary? What advice would you give that person? Because not everybody is going to be in the Power Five or have the opportunity to have that in-house physician. But how would you guide somebody at a mid-major or at another school? Because basically everybody, as we just talked about with Jill, is struggling right now with the resources. So how do you get that type of coverage? How do you maximize and leverage what you need competitively as a mid-major program or as a underfunded program in this day of COVID to get that same type of impact for your students?
Yeah, well, again, I think it comes down to really the landscape that you're operating in. And, when I was at the College of William and Mary, we had a comprehensive 23 sport program and strong relationships, outstanding leadership within our sports medicine program. And you really need to understand your value as an athletic program. And, whether there's, one hospital or 3 hospitals or one orthopedic sports medicine practice in town or several, understanding your value, knowing your metrics, and, you know, how many MRIs and everything else that you can know about what kind of spend you're going to have, and going out and forming strong partnerships. You may not be able to hire a head team physician, but knowing your value and going out and creating that symbiotic relationship with providers within your market to benefit your student athletes. And, you know, there's so many different examples of strong partnerships externally that help benefit the student athlete experience. So I think no matter what your resources are as a school or as a program, you can go out and build a really strong program, but you do need to do your homework. Again, I think something we'll talk about later in this call is leveraging your campus resources.
Right.
You know, we're so into outsourcing everything in our business, and I think sometimes we look past what's available in our backyard. And, you know, you might have a grad program, you may have a health system, you may have a certain expertise on your campus, and sometimes that's looked over. So I think you really need to take a look under the hood first before you start going outside.
It's a great point, because you don't want to be, you don't want to duplicate things if you have things already in place on campus. That also helps you internally with the politics that everybody deals with on a campus, especially when you're in the chair, as you can tell us, and obviously Jill can in her position there at St. Joe's. Let's go back on the outside side now, and Dixon from AG, your organization, you have a very unique niche in the space. What is it about your approach there at AG to the school and provider relationship that has brought your organization and your partners so much success?
Mike, thank you for that. I think at AG, what privilege we have is the fact that we serve a variety of different institutions, and we're able to understand the many ways in which a program might handle their student athlete medical expenses. And I think we could probably all agree to the fact that no program student athlete medical is created equal, right? So everybody has these unique dynamics to manage, and the relationships that everybody on this call has brought up in such fantastic context. And I think for us here at AG, as we process a lot of the transactional components of the financial side of those relationships, it's really invaluable for us to be able to provide data and information back to our key stakeholders, our clients, our partners, our insurance carriers, brokers and agents that have lines into a program and a school in very meaningful ways. That intersection of clinical direction of care and financial consequence is critical to understanding the impact of these relationships as it relates to their bottom line. And also, as Alex pointed out earlier, to really support the relationship around that environment on a campus, and as it relates to how medical providers are delivering their care to their student athletes. And as wildly decentralized as higher education can tend to be, I think we all would share a similar goal, in that student athlete health and wellness is a critical priority for everybody. No matter, as Eric pointed out, the resources that we have at various different programs and opportunities of a very unique blend of providers, like in Philadelphia that we have with Jill at St. Joseph's, and also perhaps in Eugene, where there's maybe not as much of a competitive landscape to manage. And so at AG, as we evaluate some of the trends and the patterns, and we work tirelessly with partners such as Fairleigh Group and Ocunet to come up with striking that really unique balance of what's the right rate for medical reimbursement versus, and also very mindful of that relationship that everybody on this call, and probably the panelists who are, or the attendees watching this, working very hard on a daily basis to support. Because as Eric pointed out, value comes in many shades of green. It's not always about the bottom line dollar that we're either retaining or that we're generating. It's also about making sure that we are preserving and championing the relationship that our very critical team physicians and medical partners are doing to support everybody's shared goal of championing student athlete health and wellness. And we think that is critical. And at AG, if we can provide data and trends, as Eric pointed out, how many MRIs are we accessing on a monthly basis for the variety of different sports. And if we can bring value by working with companies like Aquanet to say, we might have an opportunity to capture a little bit more of a savings to protect your bottom line. And then also just being a really good partner and paying your providers quickly. I think everybody likes to be paid. I don't think anyone is calling ADP on every other Friday saying, thank you for the paycheck. But if it doesn't show up, there's probably a few phone calls that are going to be made. So that's a really important role that we serve here at AG, to make sure that we're supporting it in a meaningful, valuable, and timely fashion.
Hey, Mike, could I weigh in on that for a second?
Please do.
I remember, I really appreciate the comments Jill made in her opening. There's this matrix of influences and priorities, and there you have to find a balance. You want marketing revenue dollars coming in, but you want a fair price, and the relationships are critical. They have to work well. I remember one of the first conversations I ever had with Dixon. In fact, it was the first conversation I ever had with Dixon in my life. He was saying, Alex, you guys are fantastic at getting to this price, but sometimes the best price isn't the best thing for our clients. And we were having this conversation about finding, this balance. I remember early in my career, I was sitting with the head team doctor of the Arizona Diamondbacks. So I was pausing whether I wanted to say there, but I'm not going to say his name. And we were talking about his relationships with the Diamondbacks. It was a long relationship. He had been working for them much longer than I had. And I asked him, how is this working for you? How do you like it? Ultimately, we were talking about the price of his services. And he said, I love working with the Diamondbacks. I love being with the players. I love being in the dugout. I love being in spring training. And I love the team, and I love the relationship. And then he paused and said, and I hate everything else about it. And I said, what are you talking about? And he said, I hate the billing, and I hate the delays, and I hate the mistakes, and I hate not getting paid on time. And so it was a great example of where we came in on behalf of the Diamondback and said, if we could fix those things and make them easier and make things happen, more quickly and more accurately and faster for you, and get rid of some of that, could this work overall better? And we were able to do that. And it just was a good example of what Jill's talking about, what Dixon's talking about. Eric has alluded to it, that there's got to be, we got to find this balance of what's the very best thing. And I love Jill saying, we got to start off and talk about what our priorities are and what our goals are. And that's to win and to have an amazing experience for these young men and women. And I think it's all possible. But it does take it just takes a balance of teamwork and understanding all the different inputs and priorities.
If I could jump in on that real quick too, the best thing about being in Philadelphia next to the cheesesteaks is having Dixon 10 miles away, because when we switched our TPA to Dixon, and at the risk of sounding like a total sales pitch, that's sort of the hub, and then the spokes of the rest of these 7 or 8 elements of our program. I mean, the sort of expertise in the market that they bring to us, and with that emphasis on, and Dixon said it, but customer service, happy student athletes, happy providers, just can't be overstated. It's been really a critical piece of our relationship. So thanks, Dixon, and the dinners are fun too.
Eric, would you like to join in?
Well, I haven't gotten probably as many dinners from Dixon as Jill has, but I look forward to it. No, absolutely. I think that that when you're looking at your matrix of providers and the services that flow through your claims administrator, you really want to find a good balance with all that. And I think there's so many different facets of student athlete healthcare that are so important right now. And having people that you can really build a partnership and that you can trust is so important. And, mental health, behavioral health, it has really emerged in at least from my opinion, as one of the key pieces of all of this. And, we work with campus and the student, health center, they're constantly overrun in this area. So, this is something that we've put a lot of time and effort into on our end in building out a strong behavioral health program to support our student athletes. So the entire picture continues to evolve for us, but these partnerships are of critical importance for us in terms of delivering on that student athlete experience.
I want to welcome everybody for being in on our call this morning. Thanks to NACDA for putting this together this morning. And one of the things that the over 125 people who are tuned in this morning have heard over the last few minutes is the word priorities. And with Eric and Jill, two folks who are on campuses right now, one at a Power 5, one at a premier mid-major, we have to set priorities when you're in the athletics department. Where do you put the resources? Are you trying to put the coaches are going to say, hey, we need another assistant coach, or I need this support person to help me recruit or to help me coach this specific skill. There's always a need out there. There's a facilities need, something like that. How do you put the priorities? How do you focus the priorities back into this area? Because for myself, and I can just speak from my experience, I'd spent my entire year on the external side of the department, raising money, selling sponsorships, doing a variety of things on the external side. So when I got to be a director of athletics, my initial assumption was, well, I'm just going to continue doing that. And the other folks around will kind of fill in, and it'll just be a nice little stew of happiness. That didn't end up being the case, because what I walked into, it's kind of like what you see on the interview is not necessarily what is reality. And when you get there, you see, wow, there are some real challenges. So as an external person, Eric, Jill, I had to go in and look around. And this is where, Medstar and Lyon came in. James Ships was hired as our senior associate AD for sport performance. And we really had to, it was a contentious time in some of those head coaches meetings, trying to get everybody to understand that they were going to maybe have to put some of their wants aside for the need of the whole of the department. What are some tricks that you could give some of the aspiring ADs or some of the ADs who might be watching on this morning of how you establish those priorities in terms of your leadership?
Eric, you want to go first?
Sure. Well, I think it starts with the vision and what you set out for your department, as Jill stated. And Jill made it clear at St. Joe's, you're looking to win championships and you want to deliver that world-class experience. And I think that's similar at a lot of places. And then it comes back to, okay, well, how do we go about achieving those objectives? And when you've got you referenced your external background and going out and trying to build partnerships. Okay, well, in that particular realm and relevant to what we're talking about on this webinar, how does that factor in to those objectives? So you may come to the table with a large sponsorship opportunity with a local health system. And okay, the administration's going to then take a look at that and say, well, what kind of revenue are we going to generate from the partnership? So, okay, do we feel like the value is appropriate for everything that's going to be included or whatever exclusivities are going to be provided through that relationship? Okay, well, now what services are they going to be providing? How comprehensive are they? What is the pricing structure? What's on the cost side of the equation for the department? And what kind of services are going to be provided? Are they located an hour away? Are they going to be making weekly or daily visits with their doctors or with their PT, or whatever the services that you're looking to provide? So you really have to take a holistic approach to looking at that relationship. And a great sponsorship where you're paying top dollar and you're not getting outstanding service may not be a great deal. So I think you have to boil it back down to what are your priorities and what you're looking to achieve in any relationship that you're looking to enter into. So as it pertains to those kind of partnership decisions, those are some things you want to look at. When we're talking about medical partnerships, I think you always want to leave yourself with options. You want to make sure that you can go out and get a second opinion. You owe that to your student athletes if they're dealing with a particular medical issue. So oftentimes now we'll see student athletes come in and something happens and they want to go see a specialist in Southern California or in Texas. And so you want to be able to provide as broad a level of service to them as you possibly can with the best possible experts in the field. So kind of a windy answer there, Mike, but I feel like you really need to be able to take a holistic approach to these conversations, and politics factor into it as well, as you mentioned earlier. And you need to understand the political landscape and what you're dealing with there, especially if you've got a university health system.
It's a great point. Jill?
Yeah, I mean, Eric gave a perfect, it wasn't even that windy, Eric, but a great overview. So maybe I could add value by talking about some of our specific partnerships and the resources affiliated therewith. So when it comes to our team physicians, through Rothman Institute, it's continuing to look at what's a win-win. How can we help Rothman? How can they continue to help us? Mainline health, where we get rehab and athletic trainers, same thing. So we ended up adding them. They're now our court sponsor in basketball, and that was a win-win for us. At the end of the day, the more we can get them involved in campus, the better for everyone. So as we go through a master plan and consider the feasibility of a student health center / urgent care clinic for the neighborhood. I mean, that's where we're talking enterprise wide, and that gets people excited. You look at mental health, we were able to hire our first contracted sports psychologist who's been fantastic. That was philanthropically covered for multiple years. The Calm app, philanthropically covered for multiple years. Sparta Science, donor paid for. And then, you look at our partnership with AG as our third party administrator and how they're helping us get our arms around cost containment. So at the end of the day, honestly, I feel like it hasn't been me pulling resources from others. It's been trying to build a world-class sport performance that gets everyone excited, and that we can add to, continue to add, whether it's marketing dollars or donor excitement. So that's been, I would say the other thing then, and Eric's obviously at a football school and I was for many years at Notre Dame. We don't have football. So our preeminent programs are basketball. We're in the Atlantic 10, fantastic basketball conference. So what do the basketballs need to themselves is one way of putting it very bluntly. Do they need their own strength and conditioning coaches? How are their athletic training resources commensurate with the rest of the A10 and the schools that we're competing with on a recruiting? So those were some decisions in terms of resource allocation. But again, when I step back and look at the big picture, this is certainly an area that I've spent a good deal of time and luckily not that much money building in my first few years.
Absolutely. So Eric and Jill have given us kind of the inside athletics mindset, but Jill mentioned just a second ago, and so did Eric, about the politics and about having to build that bridge with the academic or the overall campus side of the house. Now, Lyon, when you were at Medstar in Baltimore, you were working with us at Towson, but you were also an adjunct professor at Towson University. How did that partnership between Medstar and the school really blossom through your involvement there on the academic side?
Well, I was actually on faculty prior to engaging relationship with sports medicine. I taught a chronic and communicable disease class, but having a PhD in sports psychology, we were looking to grow a sports psych division at the university. I was able to provide sports psych services for Towson under our contract. So I think there's a lot of give and takes. There's also, because we were a very large system with 60 some sports medicine fellowship trained physicians in various subspecialties, we'd have nurses come in to teach a class or serve as adjunct professors at the university. We'd have a physician come in to give special lectures to the ATC staff or the exercise physiology staff. So we expanded it whatever the university needed. We just waited for the university to say, tell us your needs. This is part of the partnership. And you bring up a great point in what Eric and Jill had mentioned. As an outsider looking in, I find it a little found it frustrating at the end of my career to see a university, particularly D2 and D3, scramble to try to find sports medicine coverage, and you'd have a for-profit PT department come in and say, we're going to provide X to be able to serve your needs in marketing dollars, and the university grabbed that, or the college grabbed that. And then you'd find out that a year later, they came back saying they couldn't provide anything other than PT services. They just wanted our PT business. They had a doc who would show periodically. So their needs weren't met. And as Eric and Jill mentioned, their overall goals weren't even implied to the university or the group that they wanted to hire. It becomes a little frustrating that when you start a relationship, what is it that you see that relationship to be 2 years down the road, 3 years down the road? How can you support our faculty? How can you help us grow the program so that it's not strictly a bottom line? And if I tell you, if it works out very well, we found that the bottom line takes care of itself. The university is satisfied with our services, and we're very satisfied with the relationship financially as well as marketing standpoint.
Absolutely. Folks, if you have a question that you'd like to ask this outstanding panel, go ahead and at the bottom of your screen right here on Zoom, go into the Q&A section, type it in, and we'll try to work you in here over our next 18 minutes as we're going to the top of the hour. Now, one of the things that we've talked about a few times, it's been referenced, Jill just did, talking about the basketball court there with St. Joseph's, is the partnerships between the institutions and departments of athletics, is naming rights or even construction of mixed-use buildings that serve the academic side of the house, the clinical needs of athletics, while also serving as a clinical site for the provider to see patients from the public. Now, Lou and Alex, I'd be interested in getting your thoughts on the opportunity to do this type of a partnership and some of the considerations from the medical partner or the risk consulting side.
Alex, you want to start?
Yeah. The reason I pause is there's just it's just a really broad question. We're involved in, we began our early part of our careers were involved more in professional sport and have gotten into the collegiate world just in the last 10 years. And we've been involved in many, deals between teams and their medical providers. Little simple ones, big multi-million-dollar complicated ones, people's names on buildings and inventory and things like that. And there's a balance, again, that word seems to keep coming up, but there's a balance to be struck there. Like those relationships, those partnerships, they're frankly, they're critical for sport. They're critical at the professional level, they're critical at the amateur level. Like without them, college sport doesn't look like it looks. And yet, like I think Eric said a minute ago, sometimes, often people bring us a deal to help them walk through and think and look at, and the revenue, the marketing dollars are there, but the deal on this side of it, takes them all back because maybe it's, it's not so good. So there just has to be a balance. I'm not one of those folks that thinks that those things, are a little bit off limits. Like I think there's a place that we can find the balance and everyone's, interest can be, taken care of, and there can be integrity, and everyone again can win. So, but they're all very, very different. And you hear Jill talking about just, creative things. Like there's just a lot of creative opportunities out there. Almost none of them are the same. And you got to walk into those saying, the university is thinking about what our priorities are and what our goals are. And then there's a set of goals over here. And you got to find a way to make those mesh and work together. And it's doable, but sometimes you just have to work your way through it. And there's a give and take, to all of it.
Yeah, they're great points. And from the inside within Medstar, it was frustrating for me to hear the needs of the athletic director. I'd get a phone call saying, this year we'd like to know, can Medstar kick in $50,000 for a scoreboard sign? And I have to analyze the relationship. The bottom line is, did we get enough business from that particular institution to justify the $50,000 expense. As a not-for-profit and operating at less than a 3% margin, we had to make those tough decisions. It was extremely difficult to come back to the AD and say, you know, the juice isn't worth the squeeze yet. And, you know, give us some time as we grow this relationship and you grow your program and we can get ensconced into this further. I think the Medstar will step up. It was easier for larger institutions like Towson University. We had an opportunity to get involved with University of Maryland. And Eric brought up the point. Maryland came to us because the AD had stated, I don't want to keep writing this check for $250,000 each year for medical care. And he said, I like what you're doing at Towson. You got a physician office there, and it's just, my athletes go just as if it's a physician practice, and they have accessibility. I was intrigued by it, but my gut was telling me this could create a political fallout. So I asked him, do you have all your board in order and everything ready to go? Because we'd love to do it. And we had our CEO on board and everything was ready to go. I get a phone call that night from the doc of the University of Maryland, almost in tears, saying they threatened to fire me because rumors out there that I started this relationship and it didn't come from him. And unfortunately, we squelched the whole thing because, as was aptly said by Eric, the politics inherent was there was no way Maryland would allow a University of Maryland medical system not to take care of the University of Maryland athletics. It was a collegial relationship right from the get-go. So we backed away, and as Mike remembers during the time, University of Maryland has University of Maryland. Johns Hopkins has Johns Hopkins. What did Towson have? The third biggest university in the state of Maryland. And Mike said, we'd like Medstar. And we considered it an honor that we could step up to the plate to the third largest university in the state. Actually, from an enrollment standpoint, really the second largest university. So you had to take a look at what it meant to you from a marketing perspective, a business perspective, because that's why we're in the business. Hopefully the patients come to us, they stay with us, we take care of them. As I mentioned in recruiting, you get the moms and dads who need the knee replacements. You know, that's residual business that you get over time. And we just needed to make sure that we had the right talent. And we had different physicians representing physiology, representing orthopedics, pediatrics, ED, all with sports medicine fellowship training. So we could put the right doc in the right spot as we needed it. And right now what Medstar is doing is using ED physicians with sports medicine backgrounds to handle some of this COVID situation. Thank God it's out of my realm right now, being retired, but it was interesting to see how Medstar was very quick to be able to fit that in.
Well, Lou, you just made me smile because I had kind of blocked out of my memory some of the political battles that we had. We could get away with something in the university system of Maryland at Towson being the #2 school that Kevin Anderson and the folks there in College Park could never get away with. But, you know, that part of that was pushing the boundaries and not accepting where we were, which was, to use your word, ensconced at the bottom of the Colonial Athletic Association. And Eric will remember what Towson used to be, and then to see where it is right now. And that's thanks to people like you, Lou, and to James Shipp of AG, who was our senior associate AD. We do have some questions coming in. So let's go out to the wire. Callie Hannon, you were first up. And Callie's question is, how are your institutions, so this will go to Jill and to Eric, how are your institutions coping with the financial impact and logistics of the quantity of testing that is required to safely have athletics during COVID-19?
Yeah, I made you go first last time, Eric, so I'll take that this time. So, you know, we got permission, first of all, from a logistic perspective to bring on, I think we'll have 4 temporary athletic trainers, because it is just, you know, dealing with COVID on your team is a full-time job, and then handling the day-to-day injuries and rehab and recovery of your student athletes is a full-time job. So we're in a jurisdiction where the Philadelphia Department of Public Health has required that we test our basketball inner bubbles daily. So that's 52 daily tests. And that's a lot. You know, logistically, we are exploring and utilizing some batch or pool testing, which has been helpful. from both cost containment and speed of the process. So far, and then we're surveillance testing all of our other 18 sports in accordance with the NCAA guidance. So, cost-wise, we luckily we're saving significant funds thanks to the NCAA dead period on recruiting. So I've sort of matched up the savings of not having official visits and not going out on the road. That's giving us a little cushion in our budget to help cover testing. The university has been great in helping us cover some testing as well. We use the same lab as the university has for surveillance testing of the entire campus. So at some point when we ordered 5,000 saliva kits, we were able to take advantage of a good number of those for athletics. So certainly hasn't been without our challenges, but I think we were really upfront with my CFO and my president saying, if we're telling student athletes, and it's important to us for enrollment, that we were able to tell student athletes we're having sports to get them back on campus. If we're saying that, we got to be prepared to keep them as safe as we can with COVID. And so that's just a little insight into what we've been doing.
Eric?
Yeah, it's a great question. And, it's a multi-layered issue. Obviously we're subject to our state and local health authorities and the protocols that were required through them to get our student athletes back out on the field, whether it's practice or training for competition. And in the case of football and men's and women's basketball, which were less than a month out, in the case of football, a week out from resuming competition, we're required to follow a certain set of procedures. And a lot of that was managed from the center. In our conference, we have a Pac-12 health and wellness medical group that established protocols, which were then approved by our health authorities. And part of that involved daily antigen testing. And our conference went out and formed a partnership with a company called Waddell to administer daily antigen testing to our student athletes in select contact sports. And we just understand that that's right now a cost of doing business, unfortunately. And while these protocols and daily testing are going to rack up to significant amounts, it's an investment in our student athletes and providing them with that opportunity to get back out on the field. And in the grand scheme of things, at least in our case, with the revenue losses that we've seen by not being able to open our stadiums and not playing full seasons, it's actually not a dramatic number. Basically, what I'm saying is we're already in deep red ink. So it is something that we have to keep track of, though, and that we're very mindful of. But right now, unfortunately, it's just a cost of doing business in challenging circumstances.
Our next question comes from Dave Tomchek, and Dave says, how do you prepare the administration for the probability that the bottom line will not quickly align with the holistic experience? And I think we can get this both from the on-campus folks as well as our provider folks and Dixon and Alex. Folks?
Go ahead, Dix.
Could you repeat that last part of the question, Mike?
Sure. It says, how do you prepare the administration for the probability that the bottom line will not quickly align with the holistic experience? And I think there is an external provider answer to this, and also some wise counsel that could come from our campus folks.
Yeah, it's a great question. And sometimes the priorities, as we talked about throughout this call, might not be aligned across various departments, even within athletics, not to mention departments outside of athletics on a campus. And so I think what it demonstrates is the absolute criticality for leadership to prevail through a lot of these conversations. And when leadership prevails and everybody is buying into that same methodology, then you have that symbiotic approach, and you have a cadence that can lead to success and winning. And when I say winning, if our bottom line is matched up with our holistic approach and the mentality of how we want to approach different providers. And I think, knowing Dave Tomchek, he did an amazing job at UNLV on managing some of the costs associated with their medical program. And by understanding the environment around the team physicians and changing team physicians. That's probably one of the hardest challenges that I'm sure Lou and everybody's dealt with from athletic programs, if you're there long enough, your team physicians will tend to change, or your partnerships might tend to change. So I think from AG's perspective, as we look in to understand the financial allocation of your med pay, I think it's important to understand that none of the leadership is acting unilaterally. And I think as long as everybody is providing transparency over to how the goals are evolving over time with respect to direction of care and with respect to the sponsorship partnerships that are supporting the direction of care, which they have to be in alignment. And so those are some of the things I think from a leadership perspective. How can you, for the people on the panel, obviously are doing this, but the folks listening and watching, how can you advance the mission of your own institution by demonstrating leadership within your athletic program to make sure that everybody is rowing in the same direction? And I think that's something that's really important to demonstrate. And by doing something like that, I think that individual or that group or that team can advance their role within an institution. And there's nothing else that captures the essence of value than by contributing positively to the mission of an institution.
Alex?
You know, Mike, I think how I would approach this question is, listen, there's not a bunch of university administrators, coming to us looking for, answers to this question. So, but here's the reality. We are just in a crisis in our country. Like this is just hard, and it's getting old, but we're nowhere near the end. Like I don't think anyone thinks that this winter is going to be really, very good. And our approach to that is just to be optimistic and double down, looking for solutions and ways to do things better. We've done a lot of work with all of our clients, the major league clients and the amateur clients, about testing. There's going to be a new test in the market in the next 2 weeks. It's going to cost less than $10. It's going to deliver results in 20 minutes. And it's just somebody incredibly finding a better way to do things, and it's going to help everybody with their costs. This COVID insurance product that we brought to the marketplace, like I would never have thought in my wildest dreams I would just never have thought of doing anything like that. And there's just creative, amazing things going on all over the country in every segment of the population, in college sports and non-sporting places, where we're just finding better ways to do things. And I would just say we just gotta double down, and we gotta work harder, and we gotta keep positive attitudes, and we gotta be optimistic. And you hear the folks on this call, like no one's chin is down. We're just chugging through it. And right. I'm doing the things we know how to do, and Jill's doing the things she knows how to do, and Lou and Dixon and and you guys, Mike, up there, and we just see it a little more optimistically, even though it's a hard time. And I would say to an administration, okay, it is what it is. Like, we're going to make the best of it, and we're going to come out of it. And when we get to the end, we're going to have all thought of things that we never would have thought of before, and we're going to find the positives. And that's the focus of our approach to the entire COVID thing.
I appreciate it. We have about 1 minute left. Jill, Eric, if you'd like to give a quick answer to that question about the preparing, the administration for the probability that the bottom line won't quickly align.
Sure. I'll just say it comes back to our priorities, and our priorities are to educate our student athletes and deliver on that first-class, world-class experience. And, there's strong alignment, on most of our campuses between athletics and the administration. And in the case of our setup out here, the Pac-12 is guided by the decisions of our CEOs, and our CEOs are all closely involved in all the decision-making to get our student athletes back out on the field and everything that goes into helping to make that happen. So there's an alignment and a shared understanding of what's going to go into all that. And we're doing a lot of work with our campus to obviously balance the bottom line side of all of that. But, I think when you understand what you're trying to accomplish and you have the alignment. Sorry, I had something pop on my screen there. But when you have all that alignment, then you can move forward together.
I want to thank everybody for joining in this morning. That's a perfect way to end our hour together this morning on this NACDA webinar, Optimizing Your Medical Partnerships in Collegiate Athletics. I want to thank Jill Bodensteiner of St. Joe's, Alex Fairley of the Fairley Group, Dixon Gillis, CEO of AG Administrators, Lou Lyon, retired VP of Medstar Sports Health, and Eric Roedl at the University of Oregon, their Deputy AD and Chief Operating Officer. Thanks to Dana Leroy from NACDA and James Shipp from AG Administrators for putting together this morning's effort. It was a great time, and please give us some feedback back through NACDA, and perhaps we can rekindle this again, because this was the Avengers beginning game of what hopefully will be the real catalyst to help you move forward with these great partnerships in these very trying times. I'm Mike Waddell. Thank you for tuning in to this NACDA webinar this morning.